Do you frequently feel like your heart pains sometimes? Or maybe you've noticed strange swelling in your neck, belly, or under your arms that doesn't go away. While these could be harmless, they might also be signs your body is fighting something serious, like a blood cancer called mantle cell lymphoma, MCL. MCL is a rare type of non-Hodgkin lymphoma where white blood cells, called B lymphocytes, start growing out of control. Imagine a factory where workers suddenly forget their jobs and start building things they shouldn't. This is what happens in your immune system with MCL. It's sneaky and slow at first, but without attention, it can spread quickly through your lymph nodes, spleen, and even bone marrow. Great question. While doctors don't know the exact trigger, they've found a common mistake in the DNA of people with MCL. Think of DNA like the instruction manual inside every cell. In MCL, there's a typo. Specifically, chromosomes 11 and 14 swap pieces by accident. This mix-up tells the body to make too much of a protein called cyclin D1, which pushes cells to grow non-stop. It's like a car with the gas pedal stuck down. This isn't something you can catch from someone else, and it's usually not passed down in families. However, it's more common in men over 60. So, if you're an older adult noticing odd symptoms, it's worth paying attention. How do you know if something is wrong? Let us play a quick game. Raise your hand if you have felt unusually tired lately, even after good sleep. What about losing weight without trying? Or feeling full quickly when eating, as if your belly swells after just a few bites? These are all clues. MCL often inflames the lymph nodes, making lumps appear in the neck, groin, or underarms. Some people feel night sweats so heavy they need to change clothes. Others may have belly pain because the spleen or liver is enlarged. One person said, "I thought I had a cold, but the swollen glands never left." These signs creep up slowly, so it is easy to ignore them. But when they last weeks or get worse, it is time to check in with your doctor. So, what happens at the doctor's office? First, they'll likely feel your neck, belly, and groin for swollen nodes. Then, they may suggest a biopsy, removing a tiny piece of a swollen lymph node to study under a microscope. It sounds scary, but it's like sending a suspect photo to a DNA lab to confirm an identity. Blood tests, CT scans, or bone marrow tests might follow to see how far it's spread. Once confirmed, treatment depends on your health and how advanced it is. Some start with chemotherapy, strong medicines that kill fast-growing cells. Others may get newer treatments like targeted drugs, for example ibrutinib, that block the bad signals in cancer cells. In fit patients, a stem cell transplant might offer long-term control. Think of it as rebooting your immune system. Treatment is not one size fits all, so doctors work closely with you to choose the best path. Can you prevent mantle cell lymphoma? Right now, there's no sure way, since the DNA changes aren't linked to lifestyle choices like smoking or diet. But you can still take charge of your health. Regular checkups help catch issues early. If you're over 50 and have ongoing fatigue, weight loss, or swollen glands, don't brush it off as just aging. Early detection makes a big difference. Also, staying active, eating well, and avoiding harmful chemicals support your immune system. Think of it like regular car maintenance. Even if you can't stop every breakdown, you reduce the risk. Your body is your home, treat it with care. The good news, scientists are making real progress. Imagine a GPS that tracks only cancer cells. Researchers are developing drugs that do just that. New targeted therapies like BTK inhibitors, for example, acalabrutinib, stop cancer signals with fewer side effects than chemo. CAR T-cell therapy is another breakthrough. Your own immune cells are reprogrammed in a lab to hunt down cancer, like turning your soldiers into smart missiles. Clinical trials are testing combinations of drugs to make treatments stronger and longer lasting. One patient said, "I was given 3 years to live. Now it's been 7, and I garden every weekend." These advances offer hope, especially for those with returning MCL. Science is moving fast, and patients are living fuller lives than ever before.